All right, welcome everyone, dear colleagues, dear participants, panelists and attendees. Bienvenue à tous, chers collègues, chers participants.
Welcome everyone, dear colleagues, dear participants.
Caros colegas, caros participantes, panelistas y convidados. My name is Aminata Saidi, and I'm a knowledge officer in the Data Analytics and Knowledge Management Unit at the WHO Regional Office for Africa. I will be your moderator of the day, and I'm pleased to be joined by colleagues at AFRO in the WHO rooms. I'd also like to introduce our partners at the national level, namely the national research institutions based in Ethiopia, Kenya, Nigeria, Rwanda, and Senegal, who will be presenting shortly. And I'd also like to recognize our technical partners at the global level, the London School of Economics and Political Science, the European Observatory on Health Systems and Policies, and the Bill and Melinda Gates Foundation. So I will quickly run through some housekeeping notes and then lay out our objectives of the day before handing it over to our chair, Dr. Humphrey Karamaji, for opening remarks. So we hope that the platform and connections will work well. Interpretation in English, French, and Portuguese is available via the language interpretation button. So within the menu of Zoom, you can select language interpretation and then pick the language of your choice. Please reserve the Q&A function on Zoom for questions and comments regarding the presentations, and then use the chat function on Zoom for questions regarding technical and logistical issues. So we'll be monitoring both the Q&A and the chat throughout the webinar. And so I also encourage our panelists to actively engage in the Q&A and answer questions even before we go into the formal discussion section. So this session is being recorded and your attendance is consent to be recorded. Slides in the 3 languages and a link to the video after email with everyone who registered. So here's our agenda. Let me quickly go over our objectives and then come back to the slide while Dr. Karamaji shares opening remarks. So our objectives of this session are to, number one, provide useful context information on the African Health Observatory platform on health systems and policies, or AHO, introduce the theme and deliverables of the partnership, introduce the platform itself, so structure and key players, program of work, outputs, and expected results, and then opportunities for network expansion. We will be deliberating on the processes to achieve the theme and deliverables, and we'll be discussing knowledge generation efforts in the African region and approaches for strengthening the use of research evidence. We'll be discussing best practices for leveraging knowledge translation and evidence exchange, cross-country comparisons, and then share experiences with knowledge brokering and engagement with decision makers for impact, as well as with bridging the gap between evidence and policy. And finally, we'll be encouraging a community of practice moving forward. So let me just display our agenda and let me hand the floor over to Dr. Karamaji. Dr. Karamaji, over to you.
Okay, thank you, Aminata, and I hope everyone can hear me. It's nice to have everyone on board from whichever part of the world or the region you're calling in from. Welcome to this webinar. We have with us here quite a mixed group of people. Ministry of Health colleagues are here. We've got a lot of WHO colleagues in countries. We have a number of partners here, both part of the partnership, but also independent partners. We've invited a number of researchers, research institutions who are working within the Africa region, health professionals, basically a number of different stakeholders working in health within Africa, because we feel that this is an initiative which holds quite a lot of promise in terms of how we are moving forward with implementing universal health coverage within the Africa region. We are meeting virtually to introduce this platform. It's a part of the new way, the new normal, the way we're having to do business. But again, it has offered us a good opportunity to be able to reach out to a number of you and have many more people involved in this discussion. It is quite of importance to us because we feel that it's only through effective collaborations that we can move forward with achieving UHC in the Africa region. We do recognize that evidence-informed decision-making is not just an issue of collecting data and statistics. So just putting together data and statistics does not lead to the evidence-informed decision-making that we expect as we move towards UHC. It is equally important that we have a good and comprehensive process to make sense out of this evidence, out of this data and statistics that we are generating, and present it in a manner that will facilitate decision-making in countries. This process has taken more importance to us as we move towards implementing a comprehensive PHC approach to facilitate attainment of universal health coverage. At present, all the countries in the Africa region are very strongly committed towards moving towards universal health coverage, and they are trying to look at their unique ways that they want to redesign their systems and move them towards universal health coverage. I think, as all of you are aware, UHC is quite a fundamental change in the way we are doing business. We are now not talking of basic services, we're now talking about essential services, getting more involvement of our communities, of our intended beneficiaries in the design and monitoring of these services. And this is a very complex process, particularly given the complexity of health systems within the region. So we cannot anymore have a standard blueprint. I think those of you who were here in the 1980s, you recall that we had the traditional health system with a referral facility at the top, and then a health center below, and dispensaries and community structures, which was basically replicated across the region. And this system was primarily designed to provide a small set of what were considered basic services to the entire population. UHC is a completely different ballgame. We are now looking at a more comprehensive set of services which are defined by the users. And so the system cannot be a standard system. Providing support in such a different environment is of course much more complicated, and that's where initiatives such as this AHO become quite useful. AHO has been designed with this change in mind. We are focusing on how we can facilitate the country process to enable it to identify its unique path towards attaining universal health coverage. We've specifically focused on better supporting the process that each participating country is taking as they try to re-engineer their health systems and services as they move towards UHC. Service delivery systems, as we've highlighted, were primarily focused on primary care, but even with COVID, we have seen how devastated the primary care system can be if we do not provide the other services which are required. In addition, we are now cognizant of the quite high burden of non-communicable conditions, the huge challenges our system are facing with health risks, health shocks, and also the changes in the nature of the people within the African countries. It's no longer a passive kind of population. People are much more demanding of services, much more informed, and the system really needs to improve on how well it's able to be accountable to these populations. So this effort in trying to put together a process whereby we work with countries to facilitate their processes, their unique paths as they are moving towards UHC, is a priority for us in the Africa region, and it's quite well linked with our ongoing institutional approaches and mechanisms. We shall be linking this up with the Africa Advisory Committee on Health Research and Development. We're also looking at setting up the institutions we are working with as Afro partner institutions around health system and services to give it a more formal look as it's being implemented and to institutionalize the work that is going on. Health systems and policies, research is not new in our region. We have a lot of collaborations going on. I think, and also knowledge translation is not new. I think what is new with this initiative is the approach that we are taking to move towards, or to support the movement of countries towards universal health coverage. It is a supportive role. It is not a role where we have come with anything that is designed and saying this is what's going to be implemented. We're expecting that the work with the national centers will lead towards unique paths that each country has to take, unique ways that it's going to deploy its resources to facilitate it to move towards universal health coverage. This platform, this partnership is quite an interesting partnership because we bring in a number of different partners. The WHO Regional Office, of course, is one of the partners. We are working quite closely with the Bill and Melinda Gates Foundation, with the London School of Economics and Political Science, and also with the European Observatory in Health Systems and Policies, so that we can tap into non-traditional sources of health policies and systems knowledge and facilitate guidance towards the objectives that we are trying to achieve. We, of course, are also trying to see, and I think this hopefully will come out from the discussion, how we can better link this into other existing platforms within the region that are working on health policies and systems, so that there is a lot of cross-exchange of ideas. There is no limit to the amount of knowledge that can be produced and used. And really, we feel that these linkages will be quite important to be able to take forward the objectives and expectations of the partnership. As I had highlighted, the theme is on how we are re-engineering the service delivery systems within the region to align them towards movement towards universal health coverage. And we aim to focus this foundation around the PHC principles, principles of equity and social justice, community participation, intersectoral collaboration, and all these other basic principles of PHC. Whatever it is that we do, we'll be looking at it through this lens, this PHC lens, to make sure that it is aligned with what was agreed at the Astana Declaration in 2018 by the countries. We, at the moment, are at the design phase, and we felt that it's quite important that we have this webinar and engage with the wider stakeholders, because we intend to keep this as transparent and as open as possible. The platform that we are launching today, the Africa Health, the AHO platform, which is embedded within our Integrated Africa Health Observatory platform, will facilitate the dialogue and also be a point at which information can be shared. If anybody at any point in time wants to know what's going on about AHO, we are putting this platform on the table so that anyone can engage, can get involved, can see what is coming out, can even offer advice on what we need to focus on in the particular countries. At the end of the process, or as the process goes forward, it's our expectation that there will be quite a lot of cross-country learning. We do emphasize and recognize the fact that each country is going to be taking its own unique path. But then, in spite of the fact that the paths are unique, we know that there will be a lot of lessons that countries can learn from each other. If we are talking, for example, about how one country has managed to take services to hard-to-reach populations, we want to use the comparative platforms to help us to be able to look at how the different countries are solving this same problem, which can then be quite a huge source for knowledge as we move forward. So briefly, I think those would be what we'd say with regard to the opening remarks. We are quite excited as the WHO Africa region that this is being initiated. We are looking forward to the engagement. We hope that this discussion doesn't just start and end here today, but that we will continue to engage through the platform, through the Twitter feeds, and if there are issues which you feel that need to be talked about, again, we're trying to be as transparent as possible. Please raise them and we see how we can address them. At the end of the day, what we want is that the people in the region get the best possible services in the most efficient and effective manner. So thank you for your kind attention, and over back to you, Aminata.
Thank you. Thank you very much, Dr. Karamaji. So the next thing, I'm going to hand over to Serge, who will give a short introduction to the platform on health systems and policies. And I will ask that he momentarily take control from me. Stop sharing. Serge, over to you.
You're not sharing the presentation?
Let
me check. No problem. Let me check.
If you're unable, then I can continue.
Yeah, share, please. Please share.
Okay, no problem. Can you sorry, let me just one moment. Okay.
Great.
Over to you.
Thank you, Aminata. So the slides are in English, are displayed in English, but I'll present it in French. Donc, cette première slide d'entrée de jeu, comme l'a bien expliqué dans son propos.
The beginning, this is about an observatory. And why do we use an observatory? It is to have a complete view in real time to know what is going on in the health sector, and also to know what is going on with the health of population. An observatory is a structure and a platform whose main objectives is to improve availability and use of information and evidence for policy dialogue decision-making. Also to evaluate and monitor implementation of programs, generate and facilitate use of knowledge, exchange ideas, ask questions, and encourage discussions. The 4 functions of observatories are as follows. Marshals, gathering standardized data, analysis and synthesis, networking and sharing, dissemination of information. The products within the observatory are based on the action plan. The action plan of strengthening health systems is based on the SDGs. That has been validated by the Regional Committee, Africa Regional Committee in 2017. There is a selection of results through investment and then products and then results, and finally the impact. So the analysis of information products that we find within the observatory is based on these four aspects, from investment to impact, to really understand how the health system in Africa evolves, and also in the context of SDGs. Next slide, please. We need to be reminded because the platform that we will be introducing this afternoon, it is linked to the Africa Observatory on health. These are stakeholders also involved. We need to be reminded that the needs of the observatory was a request from ministers of health in the region in 2010 and 2014 and 2017 and 2019, so that Africa can have available to it a platform that will allow a reduction of data fragmentation and to offer a credible platform where we will be able to find all information on intelligence concerning health in Africa. We have data and statistics, what is happening. We have analytics aspects, why is it happening and what is happening. And then everything concerning knowledge management. How do we use this information in order to improve policies and tools that we use within health systems? The platform for health information is a direct response to this need of a unique platform, to have a unique source, a single source that gathers together a certain number of external information sources. And it is also a basis of information that works on data, statistics, analytics, and knowledge, where we have the field, a full field of knowledge of the data of the information health system in Africa, health information system in Africa. So the tool has what we call a back-end architecture and a front-end architecture to present the data on the web interface. There is a quality control on everything that we put on this platform. So the stakeholders are also involved. This slide presents the home page, the world home page of the Integrated African Health Observatory. As we said, we have a data aspect, we have analytics, and we have data and knowledge. And this is where we will find the specific platform on health systems and policies. This platform on health systems and policies is within the African Health Observatory platform. there are specific platforms concerning specific countries. Each country has its national health observatory. So we will go a bit further into detail on this platform on the policy health systems that is hosted within the African Health Observatory. In the evidence and knowledge section, the focus here is generation and sharing of policy relevant knowledge in the WHO African region. It is a matter of synthesizing or summarizing existing information to generate new evidence on health systems development in the context of the primary health care approach. It is also a partnership or a collaborative effort with partners such as the European Observatory on Health Systems and Policies, the London School of Economics and Political Science, as well as national centers that have been selected in 5 countries for this first phase. And these are Ethiopia, Kenya, Nigeria, Rwanda, and Senegal. And the 5 institutions that were selected are displayed on the slide. Kemri in Kenya, and at the University of Rwanda, we have the School of Public Health. With the University of Addis Ababa, we have the College of Health Sciences. The University of Nigeria, we have the Health Policy Research Group, and on the Institut Pasteur de Dakar, we have a team working on epidemiology, clinical research, and data science. Next slide, please.
Comment est-ce que la plateforme africaine, Observatoire africain de la santé, plateforme sur...
So, how does the AHOP operate?
Please go back. Merci.
So there is a regional secretariat, and as we said before, the platform is hosted by WHO Afro, and we work in collaboration with the countries that are involved in the first phase. Then we have national centers. For the moment, there are 5. And then we have a platform or a governance committee that orientates our activities. And then we have technical partners. And we will indicate which technical partners later. The London School of Economics, national centers, and we discuss the different projects with these technical partners, and we discuss how we are going to carry them out. Next slide, please. Next slide, please.
I was disconnected.
Please excuse me, ladies and gentlemen. The speaker was disconnected. May I please have the next slide? Thank you very much. So, in terms of content and expected results, we have developed certain AHOP products to consolidate knowledge and evidence for impact. And we are going to develop 5 products: health policy briefs, comparative analyses, country health system and services profiles, policy dialogues, and spin-off publications or materials, depending on the needs that are expressed as we go along. And this is all for the benefit of universal health coverage. And we are essentially going to be doing comparisons of countries to see who is doing things well, who is succeeding, what are the best practices, and be able to communicate these to members. So the idea here is to add value to the area of health policies and system development in the African region. So to do this, we need to be forward-looking. We need to find out what kinds of delivery systems are needed and how can we move towards these being engineered. The platform serves as a repository for systematically generated knowledge that forms the basis for evidence-informed decision-making. And the platform brings on board new partners for dialogue on policies and system development in the region. And we want to really accelerate the already developing commitment between academia and policymakers within the various countries. And policymakers being the decision makers. Now I want to give the floor to Aminata. Thank you very much, Serge, for this presentation.
I'm going to switch to English. So thank you, Serge, for your presentation. We're now going to go into a discussion of the roles and experiences of AHOP's regional network of national centers. So each of the 5 centers will get the opportunity to present their institution and some of their expectations with regard to this partnership. So we'll begin with Ethiopia. Dawit I'm handing over to Dr. Dawit. Over to you.
Yes, thank you. Can you hear me?
Yes, loud and clear.
Can you hear me? All right. Thank you so much. It's a privilege to be on this platform and present the Ethiopian National Center, which is hosted at Addis Ababa University's College of Health Sciences. I'm David Fundumageng. I'm the principal investigator for the center, to our National Center website. I'll try to be quite the second large nation now, and there has been a tremendous improvement in the areas of the remote communities through the famous health extension program and so on. But as the population increases, there remains a huge burden, both in terms of communicable and non-communicable diseases. The College of Health Sciences at Addis Ababa University is the oldest, and it is a center both training, research, and community service. And the wealth of expertise we have in terms of producing empirical evidence to support policy development at the College of Health Sciences is quite huge. Within Addis Ababa University, we bring together in this platform 3 institutions: the College of Health Sciences, the School of Medicine, nursing, midwifery, and pharmacy.
Excuse me.
In addition to these 4 schools, we bring expertise.
Dr. Dawit, can you hear me?
A World Bank, which is a hello.
Dr.
Can you hear me?
Dawit, can you?
Yes. Can you hear me?
Yes, we're having a few
Hello?
issues hearing you.
Hello?
Hello, can you hear me?
Yes.
Yes, I think there's a bit of a delay. We're having some issues hearing
Yes.
you. I don't know if you can switch connections or something like this.
Okay. How about now? Hello?
Yeah, yes, I think that's much clearer. Thank you. And then also, if you don't mind, just speak slightly slower so that the interpreters can follow.
Okay. All right.
Thank you so much.
Thank you. So our national center brings 3 institutes. One of them is the College of Health, hosts 4 major schools programs and a number of research projects in all areas. Institute of Policy Research within Addis Ababa in areas of policy analysis and evaluation. And we also have what's called the CDT Africa Center for Therapeutic Drug Trials, Africa, World Bank in the health sector. So these 3 at Addis Ababa University. Next slide. So the objective through AHO, which we want to achieve through AHO, health issues through policy briefs, policy dialogues, comparative policy analysis, and so on as interest. But we the opportunity to broker between the policy problematic in Africa, and for us to have this platform means knowledge across the whole place. Next slide. So this is the team of people from our center. That's myself and Dr. Helen, who are the PI and co-PIs. But we bring in so much experience from within Addis Ababa University, from public health systems research, from policy research background. So we hope, as at the same time, really play a role in brokering knowledge transfer between academia within Ethiopia and the region, and as well as from policymakers to academia, informing the kind of research that we do. I think that's our center. Thank you so much for the time and the opportunity. We hope to be engaged with all of you in the future. Thank you.
Thank you very much, Dr. Dawit. Thank you for your presentation of the National Center in Ethiopia. So next we'll have Kenya, represented by Dr. Benjamin Sofa. Sofa, over to you.
Thanks, Aminata, and thanks, colleagues. I hope you can hear me.
Yes, clearly.
Good, thank you, and hello, everyone. Good morning, good afternoon, good morning, and good evening, depending on where you are. I'll spend the next 5 minutes to just briefly talk about the Kenyan National Center, which has, as was explained by Saj in the introduction presentation, is hosted by the KEMRI Wellcome Trust Research Program in Kenya. Next slide. So KEMRI, for those who might not be in the know, is a semi-autonomous agency nested within the Ministry of Health that is in charge of undertaking health research in the country. KEMRI stands for Kenya Medical Research Institute. KEMRI operates through campuses, which we call centers in the KEMRI language, and our center is one of the 12 centers of KEMRI. It's designated KEMRI Center for Geographic Medical Research, coast-based and headquartered in Kilifi. Right from inception, the KEMRI Center, our KEMRI Center founded or formed as part of a collaborative, collaborative research program designated the KEMRI Wellcome Trust Research Program, which is a tripartite collaboration between KEMRI, Oxford University, with core fundings and support from the Wellcome Trust. This partnership has been in existence since 1989, and it's headquartered in Kilifi, but over time, over the years, more than 3 decades now, our research work and activities have actually spread from Kilifi, which is the coastal part of Kenya, to the rest of the country, and actually now more and more over to other countries, both within East Africa and beyond. Next slide. So this is just really an illustration of just highlighting some of our activities or our geographic reach. The far left is a map of the Kilifi County where we originally started our activities. I'm just highlighting there, small dots of blues are actually facilities or entities within Kilifi where we have physical presence, where we do collaborative work with Ministry of Health entities, particularly health facilities where we do surveillance work. Then the next map on the middle is a map of Kenya and also highlighting some of the countries in East Africa. And the dots, the red dots, the one further down south is Kilifi, basically, where we are headquartered. The red dot in the middle is Nairobi, where we actually have a large office now, a second base, and that's where actually a lot of our health policy and systems research work is conducted. And in fact, for purposes of this platform, that's where we are hosting the National Center for the collaborative program. The yellow dots scattered across that East Africa map are basically facilities and entities which we are partnering and collaborating in research work. And the last map, actually, just to show you some of our networks and collaborations within Africa, beyond East Africa. A lot of these collaborations are with collaborating research institutions, host ministries of health, and actually WHO country offices, including networks linked with the WHO Afro-Regional Office. Next slide. Just to give you a really broad map, so the research program or research center actually focuses on the entire length and breadth of health research, as the kind of name will allude. So we have organized our research work around thematic areas based on how what predominantly people focus on. But as you would see, and that is very deliberate, the concentric circles actually show that there's a lot of overlap and interdisciplinary linkages in the way we approach our research activities, both research and research capacity building. So our work is broadly organized or focusing around biosciences work, and a lot of our biosciences work, which is really basic biology work, focusing on immunology, microbiology, and genomics, is largely conducted in Kilifi, where we have huge laboratories that we've built and developed over 3 decades. And supporting that very closely is epidemiology work, both demographic surveillance work that we do in Kilifi, but also some more broader public health population epidemiology that we do across Kenya, and more now with collaborating countries across Africa. We also have a lot of work on clinical research, the largely bedside clinical research, but also more and more clinical trials. And then for purposes of this the discussion today, is where we are hosting our national center is within our health policy and systems research and ethics team, which focuses largely on 3 main areas of work. And it is within the health systems and research ethics thematic area where we are hosting the national, the AHO National Center in Kenya. So I'll focus to tell you slightly more about what we do within HPSR and around our policy engagement and knowledge translation activities. Next slide. So our health system, as I said, we are hosting the National Center within the thematic area of health systems and health policy work. Our health policy and systems work is largely organized around 3 broad sub-thematic areas, and we also kind of break this down further. But a lot of the broad categorization is focused on health system governance broadly. And within health system governance, our overarching question over the past decade or so has been working with policymakers, especially technical policymakers and decision makers across levels of health system, to examine and understand the issues around everyday, what we're calling everyday leadership and governance, and how that works to enhance system responsiveness and resilience. Then we have a broad body of work focusing on health financing and health economics, which is both looking at the financing of health, but also more and more recently working on some costing work. And then under health service delivery, we do focus a lot on issues around quality of care, especially bedside quality of care. At the heart of our health policy and delivery for this year, of the health policy and systems work within the program, is policy engagement and knowledge management. We see this both as a service and an area of inquiry. And a lot of our HPSR questions actually developed with the intention of translation or policy engagement and evidence translation as part of the process of conducting that research. So the next slide, I'll talk to you briefly about our programmatic approach to policy engagement and knowledge management. So because of our increasing interest in knowledge management and evidence translation, we developed this as our overarching framework for policy engagement within our research program. On the vertical plane, basically, I've highlighted there some of the strategies and approaches that we are undertaking for specific things to undertake engagement with policymakers. And these range from reciprocal secondment. And basically what this really means is identifying opportunities where we actually work to second some of our researchers into policymaking spaces at various levels of the system, and also vice versa, having policymakers spend time with us within the research program for basically to facilitate policy engagement and knowledge translation. We also have a specific focus and interest around strategic capacity building for policymakers to provide what we are calling evidence literacy and evidence consciousness. We do organize very periodic but issue-specific policy dialogue questions. A lot of these, the areas or the need is generated by policymakers in using through the other various mechanisms of policy engagement. We have a small group of people who specifically focus on knowledge synthesis and evidence translation. These are teams that focuses on doing quick, rapid synthesis to answer questions that come from policy makers that require kind of quick action or ideas and advice on for various policy decisions. And of course, then through our networks, we do create opportunities where various groups of our researchers, and this beyond HPSR, actually participate in what we are calling policy making spaces. So in technical advisory groups and technical working groups. And as I had said earlier, a lot of our questions within HPSR and also broadly actually within the research program are co-designed, and the research is co-undertaken by policymakers at various levels. And this is really deliberate because then it facilitates. On the horizontal grid is highlighting the reasons of for what we do this is specifically is to continue building relationships, especially based on trust, so that then it facilitates knowledge translation. Is to also aim to ensure that there's accessibility for evidence and knowledge, especially to policymakers when it's needed. It's also to motivate policymakers to use evidence and of course enhance capacity for evidence use or evidence acquisition and use by policymakers. So next slide. So what we see as an opportunity, we're very excited to be part of this, or part of the initial first five countries in the pilot phase of this. We see what the value add for AHO. We see this as an opportunity for us to first strengthen our already existence, rich history and experience of policy engagement and knowledge translation with policymakers at various levels of the system, predominantly in Kenya. As what I mean by various level is actually at the front line, especially service delivery level, at mid-level in the counties and also national level. But more importantly, what we see this platform creating the opportunity for us is to deepen our reach for evidence use, our reach for evidence use and decision making, both within the country and within the region. And particularly as we develop networks with partners across the region on this agenda, we see this for us as an opportunity to translate some of our experience and be able to, in that process, build capacity for partners, but also learn new ways of doing this so that we can expand our reach across the region beyond the country. Finally, just to very quickly, last slide, is to highlight the people behind this. So as I said, we have a big research program really with various groups of research groups. But this is what I've highlighted here, just a small group of people who are currently acting as a steering group that is hosting or spending their day-to-day life thinking about the National Center. Our far right, of course, is my first so far, with specific research interest in policy analysis and health system governance. Jacinta Nziga, who has a specific interest in HRH research and leadership development, is currently our platform manager. Edwin Baraza, who's a health economics by training, and health financing expert, has a wide reach and long history of policy and experience in policy engagement and participation in knowledge translation at various levels of the system, both in Kenya and across the region. Is a member of various technical advisory committees in country and across the region. Imelda Okiro, who is our epidemiologist in-house and is leading the population health group within the research program, her research interest has been largely on malaria epidemiology and population health generally. And actually, in addition, she brings very unique skills and interest in the work that we do, because her group has developed over a long time some geospatial skills and has actually been working with WHO Afro for the past few years to help in geospatial mapping for health services. In fact, in the presentation by Serge, so that there's a specific one of the knowledge portals they have developed is a geomap for health facilities or health infrastructure across the region. And Imelda has been very instrumental, and her group have been instrumental in supporting those activities. Kui Muraya's research focus is on gender and equity. And Sam Kinyanjui is an immunologist by training, but specifically his interest, especially in this platform, he's our director of capacity building and training. He's currently our the holder of one of the African Deltas Award, and is also a member of several other deltas within Africa. And his specific interest is to leverage on this network to build capacity or spread our reach in capacity building across the region. David Gazara has specific interest in quality of care, especially bedside quality of care, and Alex Njeru is our policy engagement officer. Thank you.
Thank you very much, Dr. Sofa, for your presentation. Now I'm going to hand over the floor to Dr. Obina from the National Center in Nigeria. Over to you, Dr. Obina.
All right, thank you very much. So I'm presenting about the Nigerian Center. So we the center is hosted by the Health Policy Research Enugu campus. It's a research group in the College of Medicine. It's a multidisciplinary team. We have people from all disciplines, well, most disciplines, social sciences, health sciences, medical sciences, and all that. So the Health Policy Research Group, where I think we have the highest concentration of health economists in Nigeria and West Africa. And then we also have very high concentration of health policy and systems analysts in Nigeria and West Africa. And then we have the skills and analytical skills and research skills on all aspects of health economics, health policy and system research and analysis, qualitative analysis, epidemiology, and public health. Next slide, please. So we've our experiences so far. I mean, we've participated in a regional kickoff meeting for AHO. We've been producing a lot of snapshots, on the Nigerian health system. We've basically done a lot of research on all aspects of the Nigerian health system. We've examined all the building blocks. We've published on all of that, and I think we've done a lot of work, publishing publication work and taking research to understand issues on universal health coverage in Nigeria. What are the constraints and how can we achieve UHC? We also have outputs on the country policy priorities, and then we have we're involved in a lot of the countries that respond to COVID, both at the national and state level. And we've done a lot of publications, blogs, and paper publications on the country COVID-19 experiences, where many members of Health Policy Research Group actually serve as members of the Ministerial Expert Advisory Committee on COVID in Nigeria. Next, please. So I think for our plans going forward, we plan to produce a lot of policy briefs, relevant policy briefs that will help us to strengthen the Nigerian health system. Policy briefs so that to engender evidence-based decision-making, and then to disseminate such policy briefs to policymakers and other stakeholders. Because one of our strengths of the Health Policy Research Group is actually, we have the capacity and the knowledge on how to get research into policy and practice. So we've worked on that. So we plan to implement some of our models on getting research into policy and practice for evidence-based decision-making in Nigeria. So apart from policy briefs, we're also applying to organize a lot of policy dialogues on many topical issues within Nigeria. We look at also planning to review Nigeria's country health strategic documents. You know, these range from the National Health Law, the National Health Act, to strategic health development plans, both at national and state level. And there are so many policies, health policies in Nigeria: national health policy, financing policy, PPP policy, research policy. So we plan to actually have a niche, you know, to help in the review of these documents, to make sure that they become topical and more useful and used for evidence-based decision making. And of course, we have skills to undertake wider dissemination through peer-reviewed journal publications, you know, so that our output will get to all parts of the world, and some of them could be actually used in other parts of Africa and not just Nigeria. Next, please. So, well, I'm not being selfish, but I mean, by the time it's only my picture that is here, but maybe Aminata, you can upload the other. I know Enyi and Professor Ozochukwu also send their pictures, but so it's not a one-man team. We also have so many people who are part of this team. I can mention them. One of them is Professor Benjamin Ozochukwu, who is a member of the Ministerial Expert Advisory Committee on COVID in Nigeria, and he's actually the national chairman of the Association of Public Health Physicians in Nigeria. So we also have Enyi Etiaba. We have other people who have skills and training in health policy and systems research and analysis. Thank you. And then I think something I have to mention is that a lot of members of Health Policy Research Group who were part of what was called the Consortium for Health Policy and Systems Analysis in Africa, CHEPSA. And CHEPSA did a lot of work on developing tools and training materials for capacity building, for policy making in the field of health policy and systems research and analysis. And we are going to bring the experiences we gained from CHEPSA in 5 years to help to strengthen the work of our hub and our national center. So thank you very much. I don't know whether you have any other slide, but I think this is the last slide. So thank you very much.
Yeah. Thank you. Thank you very much, Dr. Obina. And sorry for the timing on the photos. Don't worry. When we share the slides with all of the participants who've registered, it will be updated with all of the pictures of your team. Thank you very much. So now I'll thank you. So now I'll hand over the floor to Dr. Aline from Rwanda. Dr. Aline, over to you.
Thank you, Aminata.
Most welcome.
So thank you. We are very happy as the School of Public Health to be part of this platform, the AHO platform. Actually, the School of Public Health exists since I think the last almost 2 decades. After the genocide, the school was opened to build the capacity of health professionals, mainly with the postgraduate programs. But later on, when the high learning institutions back in 2014 were merged to form the University of Rwanda, the School of Public Health started some undergraduate program, but the school mainly run postgraduate programs. And the School of Public Health is part of the 5 schools of the College of Medicine and Health Sciences. So apart from this, the school is doing a lot of research since the last 20 to 25 years after the genocide. And it's part of several technical working groups and provide guidance and mainly on the research components and best practices. So the school has had a number of projects that we run and the research activities that we conducted with the Ministry of Health to support this component. Next slide, please. So far, with the AHO, there is a number of outputs that have been developed by the National Center, the Rwanda National Center, including the snapshot on universal health coverage, as well as the health system priorities. So these main two outputs were developed during the COVID lockdown. So what was done, we used the policy documents to identify the priorities of the health sector. But as we thought that at this point, as the launch is happening, the ministry should have a look on these outputs, and as they are aware that the center exists, and give their views on what we said in these outputs. So apart from these two outputs, there is a communication plan that was developed as other health centers and other national centers that were presented, but also a stakeholder mapping process document that was developed. Next. So to build the capacity of the Rwanda National Center, the Rwanda National Center has participated in a number of workshops listed here. And there are a number of thematic areas that have been identified, as we are planning in the next years to develop a number of documents or outputs, including the policy briefs, the conduct comparative studies. But these thematic areas, again, as I have said, we would like, again, to discuss this with the ministry to see if the ministry, we are responding to what the ministry needs. So there are actually what we have identified so far. It's the documentation of the COVID-19 best practices, challenges, and lessons learned. There is the financing to ensure equity service delivery. There is the health system strengthening resilience, and the healthcare, retaining healthcare workforce, as this is one of the issues that we have in the health system. Next. So further, after producing the policy briefs, the hits, and comparative studies, we intend to disseminate what the center will have produced through the technical working groups, through the health sector stakeholders meetings, and the use of social media and other platforms that exist, including the university existing platforms. Next. So what will be the impact actually of this project of the National Center? We, as people who have been doing research for a couple of years in the past in the country, we want to see the policy be guided by the evidence that will be generated, to put that, to respond to that gap that exists between research and the decision making, but also to build the capacity of the ministry and its agencies, that's the Rwanda Biomedical Center and other agencies that would like to gain the capacity from the school training expertise. But later on, we want to be able to improve the interactive dialogue that exists between MOH and its stakeholders, mainly the University of Rwanda. Thank you. I think that's the last slide. This is the list of few people who are currently working with the center, but there is a big group of people that will be involved in developing the outputs that the center will develop, mainly people working in the School of Public Health. We have listed only people who are involved for the moment, but policy briefs and comparative studies will involve more people that we have not listed, and we have not put pictures here. So thank you.
Thank you very much, Dr. Aline.
Yeah.
Before I hand the floor over to Dr. Lukuba from Senegal, just wanted to remind colleagues that there in the menu, there's a language interpretation button. So you just click language interpretation, and then you can select English, Français, or Portuguese as you're most comfortable. I see the question coming up a lot in the chat. So thank you very much. Let me now hand over to Dr. Cheikh Lukuba from Senegal. Over to you, Dr. Cheikh.
Merci, Aminata.
Thank you, Aminata. Good afternoon, everyone. I'm going to present on behalf of the National Center of Senegal and the Institut Pasteur of Dakar. First of all, I want to say that the Institut Pasteur is a research facility, a non-profit organization. It is of public utility, and it strives to promote public health and well-being in West Africa and in other countries above the West African region. Since its foundation in 1896, the Institute has been at the forefront of the battle against infectious diseases. It has been collaborating with WHO for a long time, and the Senegalese Ministry of Health and the Risk Assessment, Epidemic Preparedness, and the production of guidelines for major public health issues such as yellow fever. The main activities of the institutes are research, education, training, medical expertise, and the production of yellow fever vaccine. Next slide, please. So the Institut Pasteur of Dakar is a foundation that is a member of an international network, 33 Pasteur institutes, as well as other affiliate research institutions, approximately 23,000 people working on various diseases. The department that hosts the National Center is the Epidemiology, Clinical Research, Data Science, is a group of research focusing on cohort studies on infectious diseases like malaria, emergent diseases, on disease surveillance, clinical trials, and data analytics methods and tool development through teams that handle health informatics, bioinformatics, biomathematics, and recently who work on statistical genetics, as well as machine learning. Next slide. This is the team of the National Center of Senegal, 5 members, myself as heading the center, Rose Nadej Mai is the deputy head of the Senegalese National Center of AHOP. She's a specialist on public health. Mohamed Abbas Hugo, health systems and policy specialist. Mrs. Rokhaya Diop, statistics engineer and health policy analyst. And there is Hamidou Cham, who is a nurse and a works at the Senegalese National Center of AHOP. Our experience on the platform consisted of productive discussions, insightful discussions, as well as collaborations with various technical partners, and particularly with other national centers. Technical partners, I mean by that the London School of Economics and European institutions on health policies, working on health policies. We have ongoing policy brief write-ups with great support and direction received from London School of Economics and WHO Afro. We are also working on universal health coverage. We are also working on the impact of COVID-19 on the health system in Senegal. And we also work with the Directorate of Research Institutes on priorities, on health priorities in Senegal. And so there were many brainstorming sessions that took place. And here we are looking at the expected impact of AHOP on knowledge brokering. There will be provision of a global vision of the characteristics of the country's health system profile in its entirety. Also, it will give a better visibility of the country's priority health problems to allow proposed solutions in response to the needs of Senegal, and also the creation of opportunities on the platform. So this is the presentation I wanted to make. Thank you. Thank you very much, Dr. Sheikh, for your presentation.
So I will now thank you to all of the national centers for their presentations and for the, the focus on their institutions and how they've been working in this area with us and with partners. I will now hand over the floor to Dr. Karamaji. Over to you, Dr. Karamaji.
Okay, thank you. Thank you again, national centers. I think we really need to emphasize that this is, we are doing our best to make sure that this is something which is actually going to inform processes at the country level. The platform that we are launching today, the AHO, is just that. It's just a platform on which we can share, we can discuss the dialogue going on, we can look at products coming out, we can provide inputs into what kind of products we need to see, and so on and so forth. But then there will be a lot of technical work going on in the background, and that's why the national centers, as you've seen, are made up of quite a range of people. So we are really at the taking off stage, I could say. I think the shot has been fired, so we are now running. I see Chris online. Chris, it's very nice to see you. Yes, I think Chris was one of the team that had started off this process, and he's now moved on. But then as we move forward, really our hope is that we keep ourselves together. The team, the people who are listening in, if you feel that there are issues or areas that you would want to provide input into, again, feel free. That's what the platform is for, to encourage that dialogue, to provide some guidance, and so on as we move forward. I think we're trying to bring in a consortium of different actors, range from decision makers to technical people, to researchers, and so on, to try and struggle with these problems. We're not coming with any fixed solutions. there are one or two issues which have come up. We've been trying to respond to issues as they come, but maybe one or two issues which I would want to touch on directly. The first is about how other countries, which are not national centers or which have no national centers, can engage. Again, that's the main purpose of the platform, to open up the engagement. So we could have been directly talking and working with the national centers and the countries, with Ethiopia and Rwanda and Senegal and so on. But then we felt that it'd be quite good to have a common platform where any person from any country, you've got particular issues, particular views, particular inputs you want to provide into a process. If we're exploring, for example, different ways that countries have used to take services to mobile populations, to refugees and so on. If that, for example, is a topic which is being looked at, if you've got additional inputs, you could also join the discussion as it's going on the platform, as the countries are which are in the national center, which have national centers, are generating the more formal products. But also, in addition to that, you can make use of the products as they emerge. If we come out with policy briefs, we come out with other knowledge products, you can also use them in the other countries. So these knowledge products are not meant only for the use of the countries where they are produced. But finally, we would also want to see over time that this kind of partnership grows. And the demand, if the demand is strong and the capacity is there, we can expand. We are not fixed to this set of centers. If there's a need to expand to other countries, the demand is strong from those countries, we can also establish formal national centers with those countries. So it is not just work going on in these particular countries. We're also going to work a lot around the comparative studies and hope that, that based on the comparative studies, you can look at different ways that the same problem has been tackled across various countries. And I think that would be quite useful for other countries. There's quite, we feel that there's quite a lot of value addition in this process. We're having multiple countries working on similar problems, but using the same approach to address the, or to probe into the similar problems. So still going back to the same example of taking essential services to a mobile population, if we have 3 or 4 countries all exploring what is going on in their countries around this particular issue, I think that provides a lot of added value. Instead of trying to exploit on a country-by-country basis, we can immediately look at a range of examples. Each country might have 2 or 3 different ways it's addressing that problem. And when we bring all the different countries together, we then have a fairly wide range of knowledge around how to address that particular problem. But also the other added value would be, we're looking at this as the start of a process that is going to build a very strong knowledge base around policies and systems work in the Africa region. So as we move forward, we'll be having this very huge repository that is responding to different knowledge requests or knowledge challenges and how countries have addressed these different knowledge challenges. I wanted, before we go further into the discussion, to invite Dr. Felicitas Zawaira. She's the WHO Assistant Regional Director for the Africa region, to say a few words and provide some guidance on how this process is moving. Over to you, Felicitas.
Thanks, Humphrey. I don't know whether I'm visible or I'm audible.
You're both visible and audible, yes.
All right, good afternoon, good evening, ladies and gentlemen, and thank you very much. My intention initially was just to come here and listen and hear where the discussion is taking us. Having been there at the launch, as some of the colleagues have said last year when we were working on this process to see where this platform takes us, I'm happy to hear that there is progress that is being made. We are moving forward. We are launching the platform today, so that in future, it will be a question of you get to the platform and you can see what else is happening. The idea being that knowledge is to be shared, not to be kept under a bushel, as some of the people might be aware. I think the question I would have wanted to also hear from our NCs at the moment is their experience in policy dialogues. How exactly are they happening at the country level? Who is taking part? Who is actually absorbing what comes out of those policy dialogues, so that they do inform policy, but not just policy that stays on a piece of paper on a shelf somewhere, but policy that changes people's lives, that changes the indicators of the people that we serve. I think those are the critical things that, if research turns into policy and policy changes the people of the people's lives, then we are doing the work that we should be doing. I look forward to when the platform is fully functional, and at the push of the button, we can be able to see what else has been produced, who else is doing what, how can others benefit. I think, as Humphrey has said, how can the other countries that don't have NCs benefit from the work that our distinguished research institutions on this continent are working on? Africa has a wealth, as we can see, a wealth of really sharp minds and sharp brains. So the whole idea is that we can do these things in Africa. That's why we are also making sure that the observatory is anchored within the regional office, so that it's a regional good, a regional public health good that can help to save the citizens of this continent. So thank you very much for those who have taken part. Thank you very much for those who have shared what they are doing. But I'm sure there will be more questions, more interest. That's what we are hoping to generate, more interest in the work that will be done. Over.
Thank you. Thank you so much, Felicitas. I think that's really a strong show of support from the WHO side. This really, as we keep saying, is something that we think will help quite a lot in the whole area around evidence-based decision making. I want to ask Serge, are there any issues on the Q&A which you would want to respond to?
Yes, Humphrey, there's this question on how the WHO Afro will support other countries which are not currently involved in the process to create their own national center. Over to you, Humphrey.
Okay. Yes, I think I had talked a bit on that one, on the other countries. I think we had highlighted 3 key areas. One is the countries can engage in the discussions on the platform on a particular issue. If we are talking about a given issue, I think the countries can also have inputs or make some suggestions there. The second is to do with the countries. We could expand the countries. I think there's no limit as to the number of countries. So we could add a few more countries if need be, and if we have the funding and if we have the capacity. But thirdly, also then the products which will be coming out, the knowledge products are available, and the countries can take these and use them in their particular context. WHO support and the other partners support still continues in other areas of work. So this will not, we are not folding everything that we do into this area of work. I think this is of particular interest in terms of evidence generation to facilitate the reengineering of health systems that is taking place in the context of UHC. I think Dr. Felicitas had also sent a few questions to the national centers. I don't know if any of them would want to start. who would want to take the first attempt? How are you looking at this engagement at the country level with your decision makers, with the international partners around this? We do recognize in different countries that the research institutions have different levels of engagement in the policy dialogue process. And it's our hope that through this partnership, that engagement can be strengthened even further within the selective countries. So in some countries, it's quite strong already. In other countries, it's still a bit weak. We just don't know what would be your thoughts on how this partnership can help to strengthen that engagement. Who wants to try that? Obina, so far?
I could go so far here.
Go ahead.
Sure. So just to briefly just share some of the experiences we've had from Cambridge Welcome in Kenya. As I said, I mean, policy engagement has, policy dialogue has been at the core of our policy engagement activity. As I said earlier, is part of, as a research program way before the AHO days. For us, we saw policy engagement and knowledge translation as a core business for those of us who specifically have an interest in HPSR generally, but it also is actually a broader theme of interest within our research program, because we see the relevance, the value of our research being relevant when it's translated, or there's some facilitation to translate it into action, be it at the frontline clinical level or at policy decision makers. So we do a whole range, which I highlighted in my presentation, of policy engagement activities, but key among those is policy dialogue. So what we've done though historically has been that a lot of the policy dialogue has focused on issues around which we produce evidence on. So where we actually are doing research activities on. So it's more like kind of selfishly, we have been driving the policy dialogue from our end. So in a way then carefully identifying the policy stakeholders in those dialogue, both to facilitate translation, but also to generate other questions for further inquiry. So for us to create, we kind of have kind of a cyclic relationship with the policymakers. What we see this platform providing us with an opportunity for, what is the value add for this platform, is the platform provides a kind of broader resources and networks for us to expand that policy dialogue so that it becomes more policymaker driven to address broader system level questions of priority, especially with the focus for UHC as how the platform has been created. So we do see the value is that we will use the experience we've had from where we've had more of our researcher driven policy dialogue to now issue driven policy dialogue for system reengineering in the country. Over.
Thank you. Thank you so much. That's from the Cambridge Center. I think, yes, these initiatives don't have a start and end date, really. I think as we start to engage, we start to pick up lessons, we start to carry out the engagements. I think that ideally is the way the policy dialogue should move forward. And not waiting and saying that, okay, now there's a new initiative, now we're starting this. I think we've had quite a number of initiatives within the Africa region before, and these usually die out the moment the funding ends. And we really, with the design of this one, we're trying to make sure that it actually gets integrated into the institutional makeup within the countries and within the region, so that it can take a life of its own. Any additional inputs from any of the other national centers? We have Rwanda, Nigeria, Ethiopia, Senegal.
Hello?
Go ahead, Helen.
Yeah. good afternoon to you all. So I think the policy dialogue and influencing policy makers from academia and research institutes in Ethiopia has been going on for a long time, but I would say it's an informal relationship where, for example, the Ministry of Health would work with our colleagues from the School of Public Health, medicine, pharmacy, or nursing and midwifery in different projects and policy making process. But through the AHO platform, we are hoping to collaborate with them to work on the evidence generation based on what we do and also what they are looking for, and to interpret it on demand basis, but also have a formal relationship and produce policy briefs and meaningfully contribute to the policy making process.
Thank you so much, Helen. I think yes, that's quite succinct, and I think this ties in with the need of the AHO to be quite country specific and unique.
Yes.
We're really going to place a lot of emphasis on that, on trying to make sure that it fits appropriately within what the national centers can provide within each country. Each of the national centers have different areas of focus. I think that has come out quite well. And they have also different ways that they've been addressing their policy dialogue processes. Some of them are quite formal, some of them are semi-formal, and some are very informal ways that they're engaging in the policy process. None of those is correct or wrong. I think the issue is, are we getting the results? Do we have appropriate evidence-informed decision-making taking place within the countries? Okay. Saj, any other questions?
No, it's okay, Humphrey, from my side. Maybe a question from, or a comment from Jeffrey. I'll read it. It is my understanding that country did submit a couple of research group center for consideration as initial participating centers. In case it hasn't already been mentioned, it will be good to provide some summary highlights of the selection process so that in the event the unsuccessful centers do inquire, we are better prepared to provide a response. So that's a comment or a question from Jeffrey.
Okay, so that I think is to do with the identification of the particular national centers that we're working with. I think the way for everyone's information, the way this was identified was we sent out a call for expressions of interest in the particular countries. And then we had a technical process which we went through to review the institutions that had responded. I think it was a bit difficult because in most of the countries, we had more than one center which we wanted to work with. We were just limited by budgetary constraints. But then there were quite some very strong centers in a single country. Pragmatically, we just had to find a way to decide between the two. My understanding is each of the centers received the feedback with regard to the assessment and how they scored on the assessment. So if you did not receive that, we can send that back to you. In the same way, I think if we are to consider other countries, we would still go through exactly the same process. So we do not come to a country and say we're going to work with this center. We send out a call in expression of interest, and then the different academic centers would then respond, and then we have an internal way that we assess the responses before deciding. But even if a center is not selected, it still needs to engage in the process within the country. So it is not an in or out kind of arrangement. I think the idea of having the national center is that's just the channel through which the process takes place within a country. But then at the end of the day, we would want to see as much of the resource base, the technical resource base in the country being involved as is possible. So don't feel that because your center was not selected, you're not part of this process. We can look and see how we can get more and more centers involved in each country. Okay, I wanted to, hello, who is that?
That's Aminata. Can I cut in, please? So I think Humphrey and Serge did a great job of answering a lot of the questions on the Q&A, but just to raise a couple more, and I'm just going to put them all together just for speed. We have about 5 minutes left. So someone asked, could we hear more about specific examples of how you involved decision makers or policy makers in the knowledge brokering chain? When were they involved? What were their contributions and feedback? If and how did they act upon the evidence that was produced? And whether or not the partnerships of different national centers with the Ministry of Health are more formal or informal? And then the next question was, what will be the approach to developing the learning agenda for the comparative analyses? I'm hoping the national centers / AHO will also have close linkages with WHO technical programs in the areas of HSPR in the countries and at AFRO. And then there's a question, I'm going to read it in French. Il est prévu la mise en place d'observatoires pour la santé au niveau des ministères de la santé.
Are observatories going to be set up in the ministries? And for the ministry observatories that are already set up, how do you see collaboration between this observatory and those?
So Dr. Karamaji will focus on the next steps after we tackle some of these questions. Over to you, Dr. Karamaji.
Okay, I think we had tried to respond to most of those on the chat. Again, I will come back to the issue that the observatory platform is just a platform. I think a lot of the technical work takes place off the platform, and the platform is a mechanism for us to look at and see what is coming out and so on and so forth. A lot of the observatories that exist in countries are data repositories, basically. And also with the Africa Health Observatory, we had this challenge for a while, because many people, when they think about an observatory, they think of data. But I think the Euro Observatory has shown quite a good way that an observatory can actually be used as a knowledge platform, not just as a data platform. And I think that's the direction that's going. All the data that exists in the different observatories would be mirrored into this observatory, but in the data platform, not in this AHO platform. So there would be links. I think we've been discussing on a country-by-country basis, so that those links are actually strengthened with what exists, whether it's an observatory or a Ministry of Health website or the National Statistics Center, whatever it is, wherever people are hosting the health data. The issue is, how do we then mirror the two platforms so that the same data is held on both. I think the other issues, I think on the issues about the participation of the decision makers, we're just at the starting point. So I think if you can park that discussion, that question for 1 year, so that when we come back after 1 year, we can be discussing exactly that question. I think that would be the basis. We do recognize that the process of decision-making is as important, or even in some instances more important than the content. So we are not just about producing content, we are also going to be looking at exploring processes to make sure that we have the most appropriate process in each of the countries, depending on their situation. I want, before we go to the next steps, to give the floor to Logan. Logan Brenzel. She has been a very strong supporter from the Bill and Melinda Gates Foundation. She's been really helping and supporting this process. The Gates Foundation is not just funding, but they're also actively involved in trying to help to steward the process. And I'm sure they've heard very well the calls from other countries to see if we can have more national centers in other countries. I'm quite sure she's going to reflect a bit on that. So Logan, a few words to the colleagues.
Thank you very much, Humphrey, and a warm welcome to everyone, and thank you all for joining the launch of the African Health Observatory. So I'm Dr. Logan Brenzel, and I work with the Bill and Melinda Gates Foundation on the health systems team. And we're very excited for our launch this morning and eager for our next phase of collaboration with the national centers to help support robust and timely knowledge generation, brokering, and comparisons on evidence-informed policies and innovations on health systems for the region. And in particular, we're very excited about the theme this year, which is reinvigorating health services and systems, and feel that as we are moving toward coming around the corner with a COVID vaccination, that we can think about how to reinvigorate services to be able to achieve UHC and beyond. So we're at a starting point for AHOP, and we look forward to our engagement going forward, and hope that you all find AHOP to be a relevant and useful platform for your work. And we're hearing that there's maybe some additional interest in becoming involved, and we are open to having lots of conversations with our partners and our stakeholders. And we will, of course, be reaching out to you and engaging with you going forward. So thank you very much. Thank you so much to all of our partners and our team for helping to put this launch together, and for all of the good work that has been going on so far, particularly from the National Center. So over to you, Humphrey.
Thank you so much, Logan. Logan stroke Aminata. I think it came up as Aminata, but the face was Logan and the voice was Logan. So we also have our partners whom we've been working very closely with, the European Observatory on health policies and systems. Is there somebody with us from the European Observatory who would want to quickly say hello to the team? Or London School of Economics? Oh, Susie. Okay, Susie, please, the floor is yours. Susie, we can't hear you. Okay, somebody from the London School of Economics. It is, who would want to just say a few words?
Hello, this is Lesong Conte.
Please proceed.
Just really to echo the other partners' enthusiasm for this platform and the opportunity to work alongside and learn from all of the national centres and colleagues in Afro about how to lift up the data and affect change across the continent, and work with the observatories to get some answers to really pertinent questions. So looking forward to working alongside people in the platform, and delighted by the enthusiasm of those who are finding out more and more about us as we launch, and looking forward to working with them also. Thank you.
Okay, thank you. Thank you, Lesong. I think the LSE has brought quite some good inputs, some good expertise to the team, and we're quite happy to be working closely with them. Susie, you can unmute yourself now.
Thank you very much, Humphrey. I just wanted to say how much we look forward, have enjoyed working on this, and look forward to working not just, I think, on this opportunity to share data, but to really contextualize it by understanding how health systems are working and what the data means and what they tell us about how member states and countries can actually take action to adjust and to refocus their efforts on UHC. But thanks.
Okay, thank you everyone, and really we're imploring that you continue visiting the site of the platform. Whereas at the start of a process, we would want to work with as many experts in the region as possible, so that we really see how to make sure that whatever it is we are doing as we're moving towards UHC is evidence-based. I think I do agree with there's a comment which came up on the chat, and Leonard has emphasized it again, that low-income countries, vulnerable countries, fragile countries, the need for evidence-based information is even more acute. And we need to be seeing how we are able to generate evidence that is applicable in some of those situations. If you go to some of these post-conflict countries or post-conflict regions of countries, you will really see the challenge that a manager has in those kind of environments, with very limited resources and very huge expectations. How do you even focus on anything in those kind of areas? And especially when you're worried about the sustainability of whatever it is you're doing. We cannot abandon those people. We need to do something for them. And I think these are some of the questions that we will be spending a bit of time on. Please visit the platform as regularly as you can. We'll be trying to make sure there's new content on a regular basis. Raise issues. There's no question or there's no issue which is not appropriate. So please feel free to raise the issues. Apologies, there's a plane which is just flying over here. Yeah, please feel free to raise the issues as you feel or as you would want to see them addressed, and then it's up to us to see how to respond to them. With regard to the next steps, I think we are now at the end. By the end of this year, we are hoping that we should have finalized the discussions with the countries on the different knowledge, the different formats and processes for knowledge products. We're also trying to work towards a particular knowledge product related to COVID-19, not again producing the trends and so on, but something that would help the systems, particularly as they try to build back better. We're also looking at publication of dedicated outputs on UHC and country policy priorities. And also we want to initiate some policy briefs, rapid briefs especially, to start to respond to very urgent questions based on the evidence that exists on the ground. And then we'll also be producing a regular AHO newsletter, so that at a glance you can see whatever has been done, whatever is going on, and so on. And then next year, I think, is when we'll start seeing quite a lot of products coming out, a comprehensive health policy and health system and services profiles for the countries, and so on, putting together an independent advisory group, etc., etc. So we're really looking at moving forward quite fast. We're quite happy with your enthusiasm.